Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool. Here to give you an update on the coronavirus pandemic and how it's affecting Blackpool. So in recent weeks, we have seen high rates of COVID in the town, and those rates, thankfully, are now heading in the right direction. So in the last 7 days, they've fallen by about a third. So we've still got very high rates in Blackpool. So we need to do everything we can to continue this downward trend. As I said, it is heading in the right direction, but please continue to follow all the rules and go into this next phase cautiously. And I'll talk a bit about that in a moment. Firstly, I wanted to cover the situation around vaccines and getting vaccinated. Vaccination uptake has been good in Blackpool, but I think we can go further and do more, particularly in the younger age groups. I think that's where we'd really want people under the age of 40 also to come forward for the vaccine. So anyone aged 18 and now in due course in the coming days, that'll be opened up to 16 and 17-year-olds as well, can get vaccinated, and you can book through the national system. So you go on the national website and you can do it that way, or ring 119. But we've also in Blackpool got a vaccination van travelling across Blackpool, making it easier than ever for people to get the vaccine. So we've also got this additional vaccine van, and vaccinated 3,000 people through the vaccine van. So it's been really successful, and the vaccinations available on the vaccine van are first and second dose Pfizer and also second dose AstraZeneca, and there's no appointment needed. So anyone currently aged over the age of 18 can pop in anytime at the listed locations, which are on our website. They usually operate between 10 and 4, but please check the website about the details. And you can just turn up without an appointment and get vaccinated. So really important that everyone gets vaccinated, please. So do your best to get jabbed. What we know is that 2 doses of the vaccines available are very effective at preventing serious disease. Which brings me on to vaccinations in pregnancy. So I think it's really important that if you're pregnant, it's important you have both doses of the COVID-19 vaccine to protect you and your baby. COVID-19 infection can be serious for pregnant women. And it's important that anyone that is pregnant gets vaccinated. So you can be vaccinated against coronavirus if you're aged 18 and over, and if you're pregnant or you think you might be, if you're breastfeeding, or if you're trying to have a baby, or you might get pregnant in the future. You can still have the vaccine. So all of those categories can have the vaccines. The vaccines cannot give you or your baby COVID-19. Thousands of pregnant women in this country have been safely vaccinated, and many more internationally in other countries. So it's important that pregnant women get vaccinated. So please book your appointment online or by ringing 119. And finally, I just wanted to sort of emphasize the point I made at the start of this video, that people should go into this next phase. I know we've been given all our freedoms back, but it's important that we tread carefully and cautiously over the next few weeks. So please, if you can, wear face coverings where you're in a really busy place, whether it be public transport or in a supermarket. It's just an important measure to stop the spread of infection. Meet outdoors if you can. The weather's pretty good at the moment, so if you can meet outdoors, that's far less risk for getting COVID than indoors. Follow all the guidance provided to you by businesses and venues. If they ask you to do stuff, please follow that guidance. Undertake regular testing when you can, because that will hopefully allow us to detect all those asymptomatic cases where people haven't got symptoms. And of course, if you have got symptoms, then get a PCR test. So don't use the asymptomatic testing route of the lateral flow. if you've got symptoms. If you have symptoms, you need the PCR test, and you can book one of those online. If you're unsure about your symptoms, you're not sure whether you've got COVID or not, I'd rather you get tested. It's important that we do that. And if you test positive, then please self-isolate when you're told to do so, and continue to follow all the rules around isolation. So thank you very much for listening, and let's keep those figures heading in the right direction. Please stay safe, and I'll see you on the next one.